Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today as we come to you once again from the beautiful Senior Botanical Garden in historic downtown Kernersville. Well, we're here of course as a reminder because the studio, like many other buildings, have been shut down as a precaution about the COVID-19 virus, and that brings me to the fact that people are stressed out about it. People are dying, people are sick, others are worrying if they're going to become infected. Many of us have lost our jobs. We're told to be isolated. I don't know if anything could be more stressful than what we're under right now. Fortunately, we're turning to an expert today who's going to help us deal with that stress. Dr. Stephen Scoggin is Associate Vice President of Behavioral Health for Wake Forest Baptist Medical Center. Thank you for coming by the garden.
Thank you for having me, Jim. Appreciate it.
Doc, what does our body physically do when we're in a stressful situation?
Well, stress is the body's alert system when it feels threatened, be either a real threat or an imagined or perceived threat. It's a natural response. Stress is not a bad thing. Stress gets us out of the bed. In fact, a little stress is a good thing, but too much stress can be harmful.
Now, in what ways do humans react to stress? Because I know we talk about studies done with animals and how a horse will, take off running if he's stressed out or whatever. How do humans deal with this?
Well, stress activates in the body an alert system of adrenaline and cortisol. Cortisol helps us brace for what we call fight or flight. Either we're ready to fight something or it freezes us. So stress can be immobilizing, but it can also mobilize us to act.
Now, what I want you to do with this question I'm interested in, I want you to sort of combine this and say, what are some unhealthy ways to deal with stress, and what are some healthy ways to deal with stress? Give me a contrast.
Well, let's start with the unhealthy ways. One way that's going to be typical during this period is people are going to turn to substances to manage stress. Alcohol, increased drug abuse. I heard a statistic that for every 1% of unemployment, we'll have 3.5% new folks who are addicted to substances.
Oh my gosh.
So turning to substances is not a healthy way. Ingesting too much media. We can take in way too much information right now. It can confuse us, heighten our stress. My suggestion is, this is the positive of how to manage stress, is pick a media outlet that you trust. Give them 30 minutes to an hour a day at the max.
And don't just keep glued to it.
Right.
It can make you depressed, right? And stressed out.
Yeah, too much information can overload us when you're already stressed, because stress confuses us. We don't think clearly. And another negative way that we can deal with stress is just obsessing.
Yeah.
Our thoughts are confused. We start obsessing about things. We get into what we call the what if thinking. What if this? What if I lose my job?
Right.
What if?
How do I pay the bills? Now, the social distancing, that's the new catchphrase. Does that mean that we have to be totally isolated from people, even under stay-at-home orders? How important is it to stay connected?
Jim, the social distancing does not mean social isolation. So the connection, we're social animals. We've got to stay connected, like you and me are connecting today. We're outside. We're keeping good social distancing. We are finding new ways to connect, though, with folks through the digital platforms, and I think that's a good thing. So staying connected to those you love, your friends, your support networks, is critical during a time like this.
Doc, I appreciate that. I want to put up the general website for Wake Forest Baptist Medical Center. You actually go to www.wakehealth.edu is the general website. And for the radio listening audience, again, that's wakehealth.edu. Doc, I really appreciate your help on this and advice. We're going to be okay, aren't we?
Yeah, could I have a concluding remark, Jim?
Very quickly, yeah.
Let me just tell you where I think we're at. This is my perception. We went through a phase of disorientation the past month, something we've never seen before in our lifetimes. We're slowly reorienting to it. People are getting tired and exhausted, and we're entering a period of grief. So people who are tearful during this period, tired, that's very normal. We're trying to reorient to things that we feel like we're losing.
All right, I understand. And one of the things, as we said, get out and maybe enjoy the sunshine and come to the garden and places like that too. Doc, thanks for doing this.
Thank you for having me.
All right, we'll be right back after this.